triple warmer 5. Triple warmer 5 is going to be too soon above the crease of the wrist in between the ulnar bone and radial bone. And I would again recommend turning the thumb edgewise for this particular point. And there's a depression you'll be able to feel here. And then when you work this point, I would recommend turning out and then turning back in and then pulling a little bit. You'll get a little more sensation that way with this point. And use this point for shoulder, neck, pain. You can use this point for migraine, chills, fever as well. And then for the next point, I'll have you in the prone position. So now we go all the way to triple warmer 14, and I'll hang the arm off the table here. And is it okay if I pull your sleeve up? Okay. So here's the lateral end of their chromium process right here, and triple warmer 14 is going to just be a posterior and inferior. And there's depression. Here's his deltoid. There's going to be a space that you can feel just close to the posterior edge of the deltoid for triple warmer 14. And use that point for rotator cuff injury and shoulder joint issues. So that's 14. And then if the arm's on the table, you put like this, the point would be here. So it'd have a little different feel if you work with the arm on or off the table. I think it's easier to initially find with the arm hanging off the table. And then next we have triple warmer 15. So here's gallbladder 21, be about here. And then his SI 13 here at the medial superior angle of the scapula. And then there's going to be a small depression you'll be able to feel on the upper edge of supraspinatus. And that's where triple warmer 15 is. This point is a little tricky to find at first, to like feel confident you're on it, because there's no really awesome landmark. I would say the one that the books don't say is the upper edge of the musculature at this point. And then we'll have you face up on the table. So triple warmer 17 is going to be directly underneath the earlobe, not below, underneath. So you can palpate for the mastoid process, and you just want to be anterior to that point there for triple warmer 17. And then the last point we have is triple warmer 23. Triple warmer 23 is going to be close to the lateral end of the eyebrow. So if you follow it all the way out, and depending on how someone's eyebrow is shaped, don't take it literally. Here's gallbladder 1, that's at the outer canthus. Triple warmer 23 will be in a very clear depression that you can feel just kind of above the supraorbital ridge on the edge of the frontal bone. Don't get it confused with Taiyang. Taiyang's here. And the technical location of Taiyang, the books will describe if you take triple warmer 23, gallbladder 1, and use that as one side of an equilateral triangle. Taiyang will be the other point of that triangle. So triple warmer 23 is right here. Use that for headache. Okay, so make a group.